It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Thanks, my friends, for joining us on The Sam Lesante Show. Folks, I got to tell you, we had a great show for you today. You know, we always try to bring you some great information. And this guy I know for like 14 years. I can't believe it. I know this guy for 14 years. He's the president of the Lehigh Valley Hospital here in Hazleton. He's senior vice president of Lehigh Valley Health Network. And as I've been telling you since 1994, our healthcare just gets better and better. Wait till you see what today's show is all about, folks. You're going to be thrilled. John, I can't believe that I know you for 14 years.
We were just talking about it. Yeah. It doesn't seem like it's been that long. 14 years.
And,
wow.
And you know, we looked at, I remember we would have conversations in the office with Jim and the whole bit and say, what can we do to, you know, help in all areas? And boy, I'll tell you, we've come a long way, baby, haven't we?
We have. Yeah. We have the changes in healthcare nationally, as well as the changes right here in Hazleton. Yeah. You're right. We have really made some significant.
You know, it was fascinating when this connection with Lehigh Valley came in. Okay, a lot of people had mixed emotions about it, and you know, were we losing our identity, et cetera, et cetera. How did that? I mean, how it evolved so nicely, didn't it?
It did. You know, but I have to tell you, Sam, and as you know, the relationship with Lehigh Valley did not start the day of the merger. You know, we knew each other. Remember when we talked about Lehigh Valley and the emergency department and bringing the physicians in, and we talked about our telestroke program and our trauma program. They were all prior to the merger and involved the Lehigh Valley Health Network. So, you know, we had a long-standing relationship. Dr. Brian Nestor, the president and CEO of the network, was actively involved in Hazleton prior to the merger. The two of us, and Jim as well, we sat down and talked about our relationship and where we can build. And so truly, when we announced the merger on January 1 of 2014, we knew each other already. And so it was really just, as I've said this many times, it was basically an engagement that eventually led to a marriage. And so that's how I like to look at our merger with the network. It was a long-term relationship. We knew each other inside and out. We understood each other. We trusted each other, and we finally decided to tie the knot.
You know, it's amazing in healthcare, and you see how things evolve. And I've been saying this not because you're here, but I've been saying this many years. We really are blessed with great doctors, great nurses, PAs. I mean, the people, you know, the LPNs. I mean, we've been very blessed. I'm sure you have 1% that, you know, it's like but I mean, we have been really blessed with some great doctors here, I'm telling you.
We have absolutely been blessed, and so many of those physicians have been in our community for 20, 30 years. Yes. I mean, this is, you know, born and raised in Hazleton and stayed in the community, and our new physicians that have joined they fit in, they have been accepted, and they love the community, and so it's great to see that mix of physicians that have been here for so long, as well as the newer physicians joining us, and how that blends together. But you're absolutely right. It's about the people.
Total. You know, it's exciting because when I'm interviewing the doctors, you know, I can see their enthusiasm. Right. They love the area, and most of them say we just love the people. We love the area. So, you know, we're always looking to attract some great doctors or physicians or healthcare to come into our area, and I think that's a good selling point we have. You know, as a marketing person myself, you market a great team, and that's what you have established in the Hazleton Lehigh Valley Hospital. I think it's been, I see it, you know, and I think, you know, it's got to be very rewarding for you as a president.
It's a great team, from the food service staff, to the nursing staff, to the housekeeping staff, to our physicians. You know, we talk about this all the time. We all play a role in patient care. I don't care what your title is. We all have to work together in order to provide excellent patient care.
Those people that are working at the hospitals and at the wellness center, you know, my father-in-law was up at the Gunderson unit, and you know, my niece is up there, but you know, it's like that Doctor on the fourth floor.
Perkins?
Perkins, yeah. What a great guy. I mean,
Yeah.
but you know what? They're all fabulous,
Right.
okay? Valent, we have a little concern. He's my cousin. No, I'm only kidding. But I see, so I say, hey, does Fletcher ever come around? Oh, yeah. What do you think of this guy, Fletcher? We love him. He's a great guy. I said, are you sure? Yeah. And so, I mean, and so I mean, I know you're doing administrative, but, you know, it's always good, as you say, they see you once in a while
Yes.
and you're walking around. And you know what? It's not phony. You're concerned about them, John, because you've been in healthcare for all your life.
I am, and we certainly have our challenges. Healthcare as an industry, every day it's different. When I'm at the hospital and have a chance to grab lunch, I always sit with the food service staff.
Yeah.
It's, you know, we have our table,
Yeah.
and we talk about both what's going on in the hospital, but about what's going on in the community. It's one of my favorite parts of the day.
But they're telling you the facts, or,
Oh, yeah.
or is it like, oh, he's the boss, I can't say?
Well, I have to tell you, we've been doing this for a number of years, and so early on, I asked if I could sit with them.
Yeah.
And you know, I wasn't part of the group,
Yeah.
but over time, you
Yeah.
know, we talk about just about everything and anything. So I think it's a friendship.
So you're getting hands-on. I think that's fabulous. So let's talk about you know the expansion renovation project you know at Hazleton. What's happening?
We talked about our expansion project as it relates to what we're doing at the hospital. That's what I think we want to focus on today. When we, I think on a previous show, we talked about what we were going to do with our existing facility. And what we said is that we were going to move to all private rooms. That's very much a patient dissatisfier, being in semi-private rooms. And we thought we could move to private rooms. Obviously, we needed to, we talk about the emergency department, the ED department, and our challenges with the number of patients we're trying to see in very limited spaces. So what did we talk about? We talked about the expansion of the emergency department, very much needed. We talked about the expansion of the lobby area, and overall a modernization of the hospital. Mm-hmm. And so we've started the project. Mm-hmm. We are going to go from top to bottom. We're going to be renovating the facility. We've started already on the 3rd floor. I was just up there this morning. If you walk, you won't be able to, but walking through the construction area, the floors are stripped, the rooms are cleared out. We have the new nurses station going in. The renovations have started, and we're going to do floor by floor. It's tricky because we also have to see patients.
That's right.
And so the planning process is very extensive and very involved. A little bit of an inconvenience early on with the noise of getting the tiles up.
Yeah.
But I think that's calmed down, and we're going to see some of that. And so you're looking at a 1,200 square foot expansion of our lobby area.
An additional 1,200 square foot.
That's correct.
Wow.
Completely refigured, and for the patient experience, when you walk in, to make sure that we're hitting those key points that a patient or visitor's looking for, the front desk area, some of the outpatient services. We want to make sure that we keep those up front. And then we move into the emergency department. So the planning process, let me talk about the emergency department planning process. Patient flow is critical as to making sure that we design the emergency department that maximizes our patient flow. And so you'll see in the plans, the emergency department waiting areas right up front. We are going to almost double the size of the emergency department. We currently have about 18 rooms, exam rooms. We want to move that to 35. And so the 35 will consist of not just 35 general rooms, it's going to consist of 5 behavioral health rooms, a secured unit for individuals with mental health issues that come to our emergency department. We're going to have more or less a fast track program and dedicated beds, rooms, exam rooms to that. And it took a team of both the physicians and of our staff to walk through and design an emergency department that is both from a size standpoint to meet the demands of the community, but also from an efficiency standpoint to make sure that the patient flow is working correctly. We're adding second scanner right in the emergency department. Our goal is to, as quickly as possible, as soon as you hit the door, to get you to the back, to get you treated, and to make sure that we get you out in a timely fashion. Right now with 18, it's part of our problem. If we only have 18 rooms and we're trying to push patients in, we just don't have the space.
Yeah, and that always is a concern, and we discussed this with you, Dr. Valent, and many other people. I guess when you go to the emergency room, some people that are waiting, okay,
Right.
feel that they're not getting, serviced real quickly. But there's an order here. My wife, being an RN,
Yes.
explained it's not that they're ignoring you. So our public understands when you go to the emergency room, they call triage.
Yes, you go through a triage process that identifies your severity.
Yeah.
And if there's an immediate need, that you're having a medical issue that needs to be seen immediately, you go right back. If there's something that we feel that is not as severe and we have a room open, you'll go back, but many times the room's not available, and that's where we sometimes run into delays.
Yeah.
We have implemented a new program where we're trying to do a better job at our triage process and get people in and out. The new design, by doubling the size of the emergency department and by taking those lower severity patients and creating a separate area that we're taking care of those less severe patients, that's part of the design in our future plans. And so we'll have absolutely rooms that are available for the in and outs.
Okay. So now we have Express Care, okay, which is up here in the shopping center.
Right.
So how is that going to work together? Or will you continue to have Express Care?
Absolutely, we will continue to have Express Care. What we were really thinking is that would move some of our ED patients from the emergency department to an Express Care. Those lower acuity or lower severity patients would go to our Express Care. Sam, what we saw is that our Express Care took off.
Yeah.
And people are using it for exactly what it was designed, but it did not reduce the number of patients that were still coming to the emergency department. So what did it show us? It showed us that there is a community need, that people want Express Care in the community, but still want to come to the emergency department for that. So it was we thought was going to reduce the volume, actually increased our volume.
And you're still keeping a facility in Cunningham?
Yes,
Yeah.
absolutely.
So there will be any facilities that will be closed?
No.
Okay.
I mean,
so just expanding and renovating, but all the other facilities will be open?
yeah, so if you remember, there's also the Health and Wellness Center
Yeah,
expansion
yeah.
project. And so in the Health and Wellness Center expansion project, and I don't know if you want to jump into that or if you want to talk more about the hospital renovation.
At the end, I want to talk about this thing. Folks, I'm talking to John Fletcher. He's Senior Vice President of Lehigh Valley Health Network and President of Lehigh Valley Hospital here in Hazleton. Been here for 30 years, been doing a great job. We're going to take a break. We'll be back right after this. Welcome back to the Sam Lesante Show, folks. Remember, 24/7, you can watch all of our locally produced programs, ssptv.com. If you didn't download the app, I highly advise you to download the app, SSP TV. Just search SSP TV, download the app. Folks, according to what I'm reading and speaking to a lot of people, this is where it's at. All of the local programs he produces on here. Now, also for those people who don't have cable, you should have cable, but if you don't, download YouTube, subscribe to SSP TV, and there you go. You watch all of the programs. Very important, particularly with locally produced programs. Today, my guest is John Fletcher, no stranger to the area. Known him for 14 years, been in this career for 30 years. He is the big deal at the Lehigh Valley Hospital. He's been 4 years as president there, doing a fabulous job. Succeeded by Jim. Jim was great. Renovations. Let's continue on renovations. See where we're at. We went to the nursing station. We have the patient room. What else you want to talk about renovations? Before we talk about, well, you're making all the expansions. We need doctors. We
Right.
need people. Okay.
Yeah. So just to sum up on the expansion project, the emergency department's huge. The lobby area is going to be fabulous. All patient rooms are going to go to private rooms with the ability to expand to semi-private. Remember, we talked about our need to always have access if we need more beds. I think when you walk into our facility, the modernization that's going to occur, it's going to look like a new hospital.
And we're talking about completion maybe by 2019, right?
That's correct. We're hoping to complete the project by the end of 2019.
Okay, now, what about new doctors, specialists? Okay.
Right. So we are recruiting each and every day. We have an excellent recruitment firm as part of the network. We're focusing on our primary care recruitment, family medicine, internal medicine, peds, but we're also looking for urology in so many different areas. One of the things that we've talked about in being part of a larger network, we've asked the network for some assistance in providing physicians from Lehigh Valley to come to Hazleton and provide outpatient services to our community. More to come, so we'll be doing some community announcements to give them the details as to how we schedule an appointment with these physicians. We'll have that out next week. Very, very exciting. And so we have great local physicians, quality local physicians, but in addition to that, we have some needs that we want to bring from the network and access to the network to provide services here in Hazleton. Urology, that's a huge need.
Yes.
And so we are...
You have a doctor coming in
We have a doctor coming in for urology. Yeah. For right now, it's we're going to be doing it on a limited basis, and then in June, July timeframe, we'll have full-time urology in Hazleton.
Wow.
And so that's...
Will they be at the hospital or the wellness center?
No, so they'll be located on Vine Street. Dr. Srinivasan, who has left the market, right in his practice. Okay. So people are very comfortable going to his office. Okay. That's where we'll be seeing patients in urology, right in his office.
That's good to hear.
Yes, and so we're still actively recruiting with cardiology. We signed a new cardiologist that will be joining us. We've been interviewing in family medicine and internal medicine and in orthopedics, and so that's the key. You know, it's extremely important that all the renovations that we're doing, whether it's at the hospital or at the wellness center, it's extremely important that we have the right providers to continue to support our facilities and support the community. That's critical.
So how do you determine, what are the major needs? I know urology is definitely important. Okay.
And so you take a look at, there's information out there that basically states what's the population you need to support a full-time family medicine. Mm-hmm. And we look at our current situation, physicians that are maybe near retirement. And so our goal is that if there's a full-time need for a physician specialty, we want to be able to recruit and retain that physician living in the Hazleton area and practicing in the Hazleton area. But as you said, there are some specialties that we do not have a full-time need for. We just can't support them. And that is where we're going to utilize Lehigh Valley Health Network and the physicians from Allentown that can come up and provide those services that traditionally you had to travel outside of our community to receive. We're going to maximize our telemedicine services, which is also critical to tap into the network.
Since January the 3rd, there's been 51 surgeries so far in robotic surgeries.
It's growing. And so a new service that we've offered in January, we had an excellent community event where students would came in and played with the robot and had a good time with it. But that's where healthcare is going. And so robotic surgery is something that we needed to make the investment in, and we needed to make sure that we had physicians who were trained in using robotic surgery. And as you know, with the show that you did on robotic surgery, we have fabulous physician surgeons who are trained on it. And we did 50, which is great, but I think that number is going to triple.
It's going. Folks, it's on the app, the SSP TV. It's also on their website. Jane, you have the shows on the website? Okay, on their website. You got to see that show we did with the doctors. Let me ask you, when we were talking about, let's assume you're doing a robotic surgery and you need an expert, okay, and that expert is in Chicago or in LA or in Austria or whatever, okay, is it going to be an opportunity for that expert to do the surgery through robotics?
Well, you saw the technology,
yes,
right?
Yes.
And so it's absolutely possible.
Possible.
We're not there.
Yeah.
But
That's unbelievable.
Imagine 5 years ago, did you ever imagine that a
No.
robot would be doing what it's doing
Never.
in the OR?
No, yeah.
And so I think...
You would never believe it.
Absolutely
30
not.
years ago when you started in healthcare.
It's incredible
Yeah.
what technology has done.
Yeah.
And so I don't take anything off the table
Yeah.
as to what we're going to be able to do. Given
Well, you have the
technology.
TVs now. I mean, you could have a doctor in Lehigh looking at a patient, et cetera. But I think that's just, it's
incredible.
amazing. Interventional radiology, 3D mammograms, okay, there's nuclear medicine, everything that's available right now. I mean, ultra technology.
These are all new services that we're offering as part of to the community that were needed services. We are not doing this. This is very strategic as to what the community needs, and we have strategically made sure that we're bringing those resources. And these are financial commitments.
Oh, big time.
Yes.
Big time.
This is very expensive equipment. It's the newest technology
Well,
available.
I think that with Lehigh Valley, the commitment they made to the city of Hazleton, first of all, because that hospital
Absolutely.
is critical to this area, and I'm sure everyone worked with you as much as they could. Before I get into one other subject, is there anything else, John, that you would like to tell?
Well, you know,
viewers?
we're very excited about an announcement that's going to be coming out shortly with the Geisinger Health Plan. As you know, that the hospital was we participate with Geisinger Health Plan for their Medicaid business, but we just signed a deal to accept their Geisinger Gold patients, their Medicare patients. So seniors in our community that are holding the Geisinger Health Plan Gold card will now be able to receive their services locally. And so that's very exciting. I think it's going to help us keep our community services in our community, and we're very pleased. We just that was effective April 1st, and we're just going to get some information out on that as well.
Now, John, I know this is a stupid question, but I'm sure all of the family physicians that people go to are aware of all the things that you're talking about.
Yes.
So if someone goes in and they need urology or et cetera, the family physicians can say, okay, now we have this. It's a dumb question, but I'm sure they know that.
And so we're rolling out that communication plan as it relates to the specialty services that
Yeah.
we're bringing to the hospital, because that's where it starts. I mean, you know, I think it's excellent that we're saying to the community, this is what we're bringing, but equally important is to make sure that our providers are aware when you need to consult
Right.
a rheumatologist,
Right.
We have it available
Yeah,
now.
yeah.
And so,
Because I go to Dr. Benyo, okay, so I mean, he's my family physician. And his
now, is
son,
that the son?
No, the son's fabulous.
Yeah, he
I'm
is.
debating. I said, Phil, I don't know. And his son, Philip, they do a great job.
do a
you know,
great job,
but they are all familiar, you know, all the doctors, the families are familiar what's going on, okay? I got to tell you, I'm thrilled because I see more and more people seeing what we're doing, the commitment and the fact that we have such great doctors in this area. And I'm talking all the medical, I mean, you walk in your hospital, the receptionists,
Yes.
they're all nice, they're all receptive. Yes, when you're in emergency room, you got challenges, you know, and people get, you know, nervous and, but
We're working hard on that.
Yeah,
So
well,
we
you
want
do-
to make sure that we are taking care of our population, our patients.
I've seen it in action, John.
Yeah.
I hate to tell you, but I hate to be there, you know, but I've seen it in action doing a great job. Hey, it's always nice seeing you, okay?
too.
Don't be a stranger on the San Luis. I know you're
Absolutely
the
not.
big shots, but, you know, come on, bring yourself down to talk to guys like me once in a while. No, you're doing a hell of a job. You
Thank
really,
you.
really keep the good work
Thank
up.
you.
John Fletcher, folks, he's the president of Lehigh Valley Health Network here in Hazleton, senior vice president for Lehigh Valley Health Network, working for your health and doing a great job. We'll see you next time.